Okay, we're gonna start with the 25 stretches. And so, like I said before, there's no pain with any of the stretches. You wanna make sure you stay in communication with the patient the entire time, checking in, make sure they're breathing, and no pain with any of the stretches. So the first one we're gonna start with is just a little bit of neck traction. So what you wanna do is you wanna get in a staggered position here, and then you just wanna give a little bit of support here, bring this one down. You wanna interlock your fingers here, bring it down, and then you're just gonna lean back a little bit, and she should feel a little bit of traction there. It's not a big movement, but even just a little bit of traction there will give us some relief. Are you feeling that right there? No pain? No, okay. And so like I said, I'm just gonna keep checking in, making sure it's not above a 7, and with all of the stretches. And so this one you can hold about 30 seconds. You can do that 3 times, just depending on how tight their C-spine is. So their upper neck stretches here. Okay, and now we're gonna go chin to chest. So we're gonna bring your chin down here, same thing here. So one of the things I like to do is I like to rest my arms against me and just lean into that and pushing off with that leg. So all of the power is coming from that leg, and I'm not using any of my muscles. It's just all body weight. Do you feel the stretch right there? What number would that be?
7.
Perfect. So she says she feels it at around a 7. And so what we're gonna do is just remind her to continue to breathe, especially in the positions that are a little bit compromised. They forget to breathe because you're thinking about the position that you're in. So just keep breathing right there. You can hold that one too. You can do about 3 sets of 30 seconds, and then you're gonna relax. Now we're gonna go into a little bit of cervical rotation here. So we're gonna bring your chin down to your armpit there. And so one of the things I like to do here is you'll watch me as I change the stance of my legs here. So this arm's gonna come underneath, resting her head, giving it a little bit of support there. And then with the right hand, I'm gonna come down here on her shoulder, and then the left hand I'm gonna bring it out a little bit and then push down on that shoulder. Do you feel a stretch there? And this is one of the ones where we can incorporate the PNF stretching. And so when we're here, we're gonna hold here, and I'm just gonna have her push her shoulder into my hand. So you're gonna push up a little bit. So with the PNF stretching, we want to do about 70%. So I'm going to tell her, so 100% is give it all you got, 50% is half. I want you to do about 70% pushing into my hand. And what we're going to do here is we're going to do 3 seconds. So push into my hand, 3, 2, 1, relax. And every time we can go a little bit deeper. Go ahead, go again, 3, 2, 1, relax. And you can do that for up to 5 seconds, 10 seconds, just depending on how tight the area is. And again, 3, 2, 1, relax, and then rest there, bring it back out, and then we'll do the other side, same thing. So hand underneath, bring this one back, and then I'll change my stance, bring this one here, and then we're gonna come here, 3, 2, 1, relax, and then again. You can do as many cycles as necessary, just depending on the tightness. But for the sake of this video and time, we're just gonna go through 1 or 2 cycles just for demonstration. 3, 2, 1, and then relax. And then we're gonna bring that one back out.